Hi, my name is Brady Starks, and I am currently an undergrad at Central. I am majoring in psychology with a minor in law and justice. So for the purpose of this presentation, I wanted to focus on the career of a CDP, which is a Chemical Dependency Professional. This job title, there's a ton of variations in the title names. There's substance abuse counselors, there's chemical dependency counselors, there's chemical dependency treatment professionals, there's just a whole wide range of them, but most commonly known as CDP or chemical dependency counselor. Here in Washington State in 2017, the income range for this profession went anywhere from about $41,000 up to $60,000, with kind of $51,000 a year being kind of the median salary for this job, not including benefits. Typical benefits, though, do include Social Security, retirement, 401k, healthcare, pension, paid time off. Roughly those equal about $24,000 in added benefits per year. So if you take that 51k, you're really kind of making an average of $75,000 a year in this job title. The lowest level of education needed to obtain this position is you need at least 90 quarter credits of college. If you don't have an associate's, which you should by then, but if you don't, to become licensed in the state of Washington, you need at least 90 quarter credits. A lot of places do require that you have at least your associate's degree, but for whatever reason, if you don't have it, but you have 90 quarter credits, you can still apply to get this license. It is important to note, though, while you are in the process of fulfilling the needs for the requirement for the license, you are just a CDPT, which is a Chemical Dependency Professional trainee, until you actually receive your license from the state of Washington, and then you're a CDP. So that's kind of the difference there. So of those 90 credits that you have, 45 need to come from at least this. There's a whole list of the classes required, but for instance, I'll show a clip here in a second that lists all the classes available, and you need to have at least 45 credits from variation of those classes. But for instance, courses on counseling, addiction, substance abuse, etc. So I'll show that here in just a second, and I'll pull it back up later. The most desirable level of education for this career is your associate's degree. While you can still get licensed without it, I think it is the most desirable, and it's kind of like the borderline what companies are looking for to hire someone. They're looking for you to have at least your associates. So to become licensed in the state of Washington, there's a lot of requirements that you need to kind of get under your belt before you can apply for your license. One of them is you will need at least 4 hours of AIDS HIV training. The other one is you need to have logged hours of experience. So if you have your associate's degree, you will need at least 2,000 hours of clinical experience. If you have your master's or your doctorate, you will only need 1,500 hours. So there is an advantage there if you do have further education beyond your associates. Kind of cuts 500 hours off. So of those hours combined, you will need X amount subdivided. So for instance, you'll need X amount of hours of family counseling of those 2,000. You will need so many hours of face-to-face time, so many hours of just clinical evaluations, so much time spent with couples or individuals, group sessions, etc. So you do have to have a lot of time supervised before you can apply. Also, at the end of that, you will need to pass your board exam. There's 2 available in the state of Washington that they will accept. The first one is you need to pass the exam from the National Association of Alcoholism and Drug Abuse, and that's kind of the main one. But you could also take the ICRC exam and pass that, and you could fulfill the exam requirement for your license. So you do all that and then pass your exams, and you are actually licensed in the state of Washington, so you are a CDP. So you may be wondering what a CDP does on a daily basis. Day to day, things are never exactly the same, especially since you're working with people. But it can vary. Some CDPs will specialize in a certain age group, adults versus juvenile. Some will work with both. So that's kind of a difference there. But typically you're going to be doing face-to-face meetings, whether it's individual counseling sessions or group sessions one-on-one. That can change. Basically, you're going to help them find ways for them to cope. You're going to incorporate methods they can use to help overcome their addiction, to come into recovery. You're going to provide guidance and support for these individuals. Since you're working with individuals who have addictions, you can receive a phone call at the drop of a hat and need to see somebody right away. Because addictions aren't the same for everybody, you could see one person once a week and they do okay. Or maybe you need to see somebody every other day because their addiction is taking so much from them. Also, you will administer UAs. You will, if the person you're seeing is under court supervision, you will be required to submit compliance reports to probation officers or to court staff. You'll also be required to submit results of those UAs to see if the person's actually staying clean, etc. You could be in charge of leading group therapy sessions. It really, it varies all the time, but a lot of times going to be face-to-face time with clients who are struggling with addiction, and you're going to be there as a mentor, as a support, as somebody to help guidance them to pick the pieces up of their life and kind of rebuild them and just support them through their levels of recovery, being there for them. So other jobs that are related to this career field are going to be anything that have to do with counseling, behavioral health counseling, mental health, addiction support. There's a lot that this can evolve to and relate to. There are opportunities for advancement. However, those will come with further education. So say you start with your associates and you go on to get your master's, that can lead you to become a licensed mental health therapist. If you go on from there and get your doctorate, you could go on to become a psychologist who specializes in mental health or just substance abuse, alcoholism, or just drugs. It really depends, but the advancements that are there are with continued education. I'm sure in a small practice you could become like an office manager and oversee everybody there, and that necessarily wouldn't require more education, but kind of if you're looking for huge advancements, you would need to go on and further your education. This expected demand in Washington state for CDPs is expected to grow huge. In 2016, it was estimated that the growth for CDP and substance abuse counselors was going to increase at least 22% within the next few years. So that's huge. Yeah, that's huge. It's estimated in the United States that only 11% of individuals across the nation with substance abuse problems are receiving the help that they need. So that's 89% of individuals with these problems aren't getting the help they need, whether that's from lack of available services to where they are, whether they're just not going out there and getting it. It's just, there's a huge demand across the nation, and this is, unfortunately, it's a field that's growing. Drug use is growing, so there's always going to be that demand for it, unfortunately. So courses in psychology that you can take, that would be good for you to take if you're thinking about going into this career, would be any courses related to counseling, also any courses about substance abuse or dependency issues. Those will really help you become an effective counselor yourself, so it would be very advantageous to take these. So as far as volunteer opportunities, that would be great for a person to take as an undergrad, would be any sort of work with, say, Oxford houses, Serenity houses, There's so much out there, services available to people who have, homeless or who have substance abuse problems, addiction problems, who can't get clean. Volunteering with any of these organizations that specialize in helping people like this would be great for an undergrad to kind of get in there. It's going to give you exposure to these people, to kind of get familiar with them. It's going to give you that face-to-face time, so you're comfortable working with people face to face. It's one thing to read about typical mannerisms of a person, what to look for, things like that, versus going out there and being right next to them. That exposure in those groups is going to give you more knowledge about them. It's going to give you kind of an insider's look on maybe kind of what they need as far as help, kind of where their mind frame is at. So any of that, while it's not required to actually go out and volunteer, I would highly recommend it, because it's going to make you that much better when it comes time for you to sit down and have these people as your clients. It's just going to be very beneficial. Not only that, I personally have volunteered in groups like this before, and it's eye-opening. And it's kind of a bittersweet feeling, because it makes you very grateful from where you are in your life right now. But it also, it kind of, for me, because I want to be a CDP, it gave me more of a boost of my drive. I want to help these people. I want to get, if I can get one person back off of drugs and, into recovery, that would be amazing. It's just, it's very heartwarming too. And it can also be very disheartening. But I encourage anybody, even if you're thinking of possibly being a CDP or a counselor, go out there and volunteer. Spend some time with them, because we're all people, and inside we're all the same. So you can begin these volunteer activities really at any time, since they're not required. And overall, like I said, it's just going to give you this huge increased level of awareness on how to deal with these people. So the gaps that tend to exist between the formal education and the skills needed to be successful in this position kind of circle around that face-to-face interaction. For me, I'm an online student, and you can read about how to be effective with people and read the things you need to do to be effective with people, but unless you get out there and you are face-to-face with people, it's one of those skills you acquire when you're doing them. That's why I encourage anyone to volunteer. But also within that, though, to become licensed, like I mentioned earlier, you have to have, say, 2,000 hours of time, face-to-face time or evaluation time. So the state license kind of makes it required that you will build these skills through that. So it is a gap, and it's also not a gap. You lose that social face-to-face. So what a person might expect to learn after joining this field is a number of things. You can expect that you are going to be dealing with people who you may view as productive and successful members of society and think they have their stuff all together, but they could be battling their own demons. They could be battling with substance abuse, and you could never know. So you are going to be uncovering, some deep, dark secrets from people. And while on the plus side, it's positive because you can be that person that, that voice of reason, that person that's there to help them and bring them away from that, you're also going to be dealt with seeing the worst of people. You're going to be brought into their cold reality. Another thing you can expect to learn is that drugs don't discriminate. Drugs and addiction can take whoever. Like I said, a lot of times it'll be maybe the person you least expect, the person that came from the best of the best and just, fell off the path. One thing I've learned with this is that working with youth who have substance abuse problems, it's very powerful. And as a mom, it's probably the hardest thing to deal with, because you want to nurture them and you want to love them and fix them and help them. So you can expect to have a lot of those moments. Overall, a CDP affects the community in so many ways. You are helping reduce drugs and substance abuse can be linked to crime and criminal behaviors. You're essentially trying to take these people and mold them into, or give them the proper tools they need to become productive members of society. You know, you're working in your own community, probably, but you'll be working in your community with people that you know, and just, you're there to help them. You're there to make the community safer and getting drugs off the street, and overall you're going to be affecting the safety of your community. You're going to be helping lower crime, and everyone knows that lower crime reduces so much. It's just like this ripple effect. So that's why I chose to talk about CDPs, and I encourage anyone who is even curious about this field, research it, go volunteer. Like I said, I have, and it's eye-opening, and if you have that passion to want to help people, it just might be a career that's for you. It's fairly easy to get into it. The demand is huge. The pay is not so bad. So yeah, that's that. Thank you for listening.